Hey, welcome out to this evening's training on Adaptiv. Tonight's training will be presented by Dr. Dolores Stevens. She is a naturopath physician that focuses primarily on underlying viral infections. In her practice, she treats her patients as a whole person, which includes mental, spiritual, and physical health. And she was very excited about the Adaptiv line, and so I'm really excited to learn from her. So, Dr. Dolores Stevens, go ahead.
Thank you, Seth. I'm really excited about this. So let's do a little housekeeping before we jump into the content. If you aren't familiar with Zoom, in the upper right-hand corner is speaker view. You can click that button that allows you to just see the person that's speaking and not everyone's, unless you want to look at everyone. Also, down on the bottom bar is a chat menu that if you want to put in the chat where you're calling in from and maybe who invited you. That allows us to make sure that everyone is taken care of with any questions that may not get answered tonight. So I hope that's helpful. So I'm really excited about this. And as I told Seth, you don't know anything super well until you are getting ready to teach it. So studying never ends for doctors. I've been studying for many, many years, and as well as really intensely in the past couple of weeks as we decided to do this class. So I wanted to be prepared to make sure everyone was as well informed as I possibly could. I'm going to share my screen with you because I have prepared some information for you. So hopefully you can see that. So let's see. All right. So as it's getting ready, let's see. Also, you will be muted during the call just to help with cut down on feedback. So if you have questions, make sure that you're asking those in the chat box, and if I'm not catching them right away, I'll make sure that I cover them at the end. One reason that I wanted to focus on the mind wellness, and you can call it mental health wellness, you can call it stress wellness, you can call it whatever you want to call it, but when we look at naturopathic approach, we don't look at things in compartmentalized. And what I mean by that is a lot of times what we see is that patients come into us where they've been to a physician or a multiple number of physicians, where one is treating your GI symptoms, one is treating cardiac symptoms, one is treating your anxiety, another is treating pain. And so you kind of sometimes feel compartmentalized. And the way that I was trained in medical school was to treat the person as a whole. And so I'm going to go over a little bit about my background so you can understand a little bit more about who's talking to you, because I know that's important when we're gathering information, to make sure that the information is coming from someone that we know has done the work behind what they're presenting. So as we look at treating the person as a whole, then we have to embrace the emotional, mental, spiritual well-being. We cannot just look at the physical side. So I love what we're working on here tonight because it has literally changed not only my health, but many other people. So I'm really excited to share that with you. So we're looking at mind wellness, when we're looking at rest and focus and stress and mood, when they all work in harmony, and our anatomy and our physiology responds to that. It's just a beautiful process. So we're going to look tonight at the adaptive system. As you may or may not know, I work with an essential oil company called doTERRA, and I'm sure you've heard of it. If you haven't, just know that we are here tonight to share information with you so that you have all the tools that you may need in your own health toolbox, or if you're a healthcare provider, that you could provide that for patients as well. So if you have questions about this, let whoever invited you know if they don't get answered tonight, so that we make sure that you're taken care of as far as all the information that you need. So give you a little bit about my background. My name is Dr. Dolores Stevens. I am a naturopathic physician. I've been in the medical field since about 1995 with a background of being a registered respiratory therapist. I worked in the emergency room and ICU, so I really have a lot of compassion right now for the respiratory therapist during this global health issue. I was also a certified cardiographic technician, so I read EKGs every single day. I interpreted those for physicians. Also went back to be a licensed massage therapist because I knew that there was a disconnection in the healthcare system. I was seeing it firsthand, so I really wanted to get touch and human contact back into that form of medicine that I was seeing in allopathic world. And then I went on and became a licensed naturopathic physician. I also saw in my work that so many of people's physical illnesses were deeper, and we just had to keep digging. And I also found that grief a lot of times was a launching point for something really serious that happened physiologically. So, a very serious illness, many times we could trace it back to a grief event. So I went and received some more training to become a certified grief recovery specialist. I really embrace the emotional, spiritual, mental side of our whole components here. We're not just physical. So I did training to understand the energy side of our body, the spiritual, energetic side. So I did a lot of work learning Reiki, that energy healing in general, shamanic medicine. I just embraced it all. I took all of the healing modalities all over the world that I could find, Ayurvedic, just everything, and just compiled it into one bundle of tools to provide patients. And I had someone say, it just kind of seems like a jack of all trades. What I really want people to understand is we're not sections. We're one whole person. And I really want us to look at that as we look through this presentation tonight, to really think about, I'm a whole person. There's not just cells. There's emotions. There's a spiritual side of me. There's a mental, a physical, all of it works together. In my training in naturopathic medical school, we are extensively trained in nutrition, also in biochemistry, botanical medicine, which is also, that is essential oils, homeopathy, naturopathic counseling, all of that works together to help us. That's in addition to what we normally get in medical school, all of the anatomy and physiology and all the science to help us diagnose correctively and to treat correctively. These things were kind of a bonus in naturopathic school that we received. I did some intensive internships in naturopathic gastroenterology and in naturopathic cardiology and pulmonology, as well as ENT. Also specialized in an area called Nature Cure, and that's where we use nature to really help the body heal itself, because we know that the body can heal itself if we just kind of get out of the way and give it all the support it needs. In my practice focus, I really focus on underlying chronic viral conditions. Epstein-Barr virus is, as we say, my jam. I look for that. I find it in a lot of patients. There's a lot of GI connections with that. There's a lot of chronic pain. I work in grief recovery, spiritual healing, and I focus a lot on that anxiety and grief, mental health picture and its relationship with their physical condition. So to me, whole healing is about body, mind, and spirit. So I want to show you some statistics really quick, because it's important that we understand the effect that stress can have on us, so that we know why it's so important for us to move forward in taking care of the stress and how it can affect us. So we looked back at a century ago. In the 1900s, the leading causes of death were things like tuberculosis and pneumonia, diarrhea and gastroenteritis and heart disease. And that was in the 1900s. And then when we just looked in the year, starting in the year 2000, heart disease was number one, cancer, strokes, chronic lung disease. What we know is that looking at chronic lung disease, we know that grief gets stuck in the lungs. Anger gets stuck in the liver, which is the liver is what supplies the heart with the blood. And so in cancer, when we look at stress, and anger and emotions that get stuck in our cells, they create this mutation in our cells. And so when we look at the comparison of the two centuries, in the 1900s, we can see that those things were things that we were like exposed to, you know, tuberculosis, or, you know, we were exposed to someone with that, or a condition created that we were in created pneumonia. In the 2000 century and on, then we're looking at more lifestyle related things that are those leading causes of death. So that helps us see how much control we have over the things that are affecting our health. I want to look at women, because we have a lot of women on this call, a lot of women in doTERRA. My house, it was always full of women. I had 3 girls. My mom had 4 girls. And so, and a lot of my patients are female. And so I really like to look at the things that are affecting women in our health and what makes us more at risk, so what to look for. So when we look at women's death rates, this is age 35 and above, and this is across the United States. You can see, and I apologize for those of you not in the United States, that just looking at the US, we can see the areas where heart disease is more prevalent. So it kind of helps you see. Yes.
Are you sharing your screen?
Yeah, can you not see my screen?
I do not see it. Are you? Maybe it's, I hope it's not me, but it sounds like you're speaking from a presentation, but I'm not seeing it.
Okay, let me.
I can see it.
It's just me.
Okay,
Yeah, I can see it.
all right, let me
Perfect.
reshare. Okay, can you see it now, Seth?
Yes, I can. I don't know why I couldn't before, but now I can. Thank you.
We can see it.
Great, thank you everybody for the confirmation. Appreciate that. Okay, so see where you are on this map if you're in the United States, and see where your risk factors may apply to you. So I just thought this was like really interesting information, and it kind of made me step back, because I'm from Alabama originally. I'm a full-time RVer right now, so I travel a lot. So I'm looking right now at, oh wow, I'm from that northeast corner of Alabama, and that is pretty bright red. So look and see where you are on this map, and it helps you know like what your risk factors are as far as like just geographically, not talking about genetically. And the reason that I'm talking about heart disease here is because we just saw in this previous screen that lifestyle related heart disease is definitely more prevalent now. So we want to be aware of that. So it's a lot about just being aware. Also looking at these stressful stats, as if we don't have enough, when we look at 1 in 5 Americans have experienced extreme stress. And we hear more and more now about panic attacks. And almost all of us have had a panic attack for some reason or another. And if you haven't, count yourself lucky. You know, you may have shaking, heart palpitations, depression, all of that, you know, is from extreme stress. And so stress is the basic cause of 60% of all human illnesses and disease, as well as 75% of doctor visits. So think about if you were able to reduce your stress or your family's stress, your doctor visits could reduce greatly. So we're looking at 75% of those visits. And I can attest to that, because so many times we have people come in and they sit down in that chair and I say, so what's going on? They're like, I'm so stressed. And that's one of the, you know, primary things that we hear a lot, or they're so in a lot of pain. And when we dig into that pain a little bit, it actually goes back to the stress. We also found that over the past year, 74% of people have at some point felt so stressed that they felt overwhelmed or unable to cope. So if there's 4 people standing there, there's only 1 of them that has never felt that. I have felt it. I've been through medical school. You felt it. If you have kids, you have felt overwhelmed before. If you had a job, you felt overwhelmed, unable to cope. Now, this is a great amount of stress that we're dealing with. And what we know is that it affects our body, and it affects our anatomy, it affects our physiology. There's a Harvard study that shows that they have been able to find links between stress and autoimmune disease. If you know me as a physician, you know that I treat a lot of autoimmune disease cases, and so I see it hand in hand. I also have a lot of other thoughts around autoimmune disease, but this is very important because the prevalence of autoimmune has gotten so much stronger in today's time. And with everything going on now with our global health issue, you know, we're really looking at how do we move back into the working world when that happens and keep our stress levels down, because we've been in a place of slowdown, and now as we move into a place of, you know, of more activity, we want to try to really have a better handle on our stress than we've had in the past. So you may wonder, what does stress do to my body? Well, we've heard about sympathetic and parasympathetic, rest and digest, fight or flight. You know, we've heard all those phrases. Let me show you what it does to your organs, though. This is what happens in your body. So we're first going to focus on the left side, the sympathetic, the blue side. This is your fight or flight. This is when you're going on a walk in the woods and you hear a rustle in the leaves, and it's funny because in medical school they always said the bear is chasing you. You know, this is what happens when a bear is chasing you. And I'm thinking, I've never been chased by a bear, but I still know what it feels like to be in this stressed and sympathetic state. An example, I've been driving a car and almost had an accident, whether that means someone almost hit me, or I almost hit someone, or I ran a red light and I saw someone coming and they almost T-boned me. That panicky feeling that just overwhelms your body. You have no control over the way that your body feels. You may feel immediately like you've got a rush of blood running through your body. Your heart is pounding. You look in the mirror, your face is flushed. That is your sympathetic system that kicked into gear to help you react quickly. And when that happens, our pupils dilate. We're going to start at the top. Pupils dilate. Our salivation is inhibited. And you may think that's no big deal, but here's what happens when our salivation is inhibited. Our digestion starts in our mouth with our saliva. That's where carbohydrates begin to be digested, is in the mouth from the digestive enzymes that are in the saliva, amylase, all these digestive enzymes. So it starts in your mouth. If your saliva is inhibited, you're not able to start that digestive process adequately right off the bat. Then we have bronchial dilation. So this means your airways are more open than they need to be. And so if you're running from that bear, that's a great thing, because then that means you've got plenty of air to pump through so that you can run. Well, we're not running from a bear, but our airways are constantly open more than they should be, or they're open so much that they're bringing in more allergens and environmental toxins that we need, and then we have a bronchial reaction to that. Our digestion is also inhibited during that time. So when you are literally running from a bear, you don't need digestion to happen. It all stops. So if your body thinks that you're always running from the bear, do you think that your digestion is going to work? No, it's not working very well. I cannot tell you how many times I talk to people about their digestion, and very few people have optimal digestion that come in to see me. And it's kind of a running joke that if you talk to a naturopath, you're going to talk about poop. And because it's really important for us to know which system your body is normally in. Are you in sympathetic or are you in parasympathetic? And so just knowing that, if you think about how your digestion normally works, you have a good idea of if you're in the blue or if you're in the red. And so an example of that is if you're eating 3 times a day and you're not having 3 elimination processes a day, you're not working in that relaxed state. It also causes your liver to release more glucose, and this is because that is needed for that running from the bear system. But what that happens on an ongoing basis is that we have, we see so many then with like dysregulated glucose, where you may have insulin resistance, or so many issues that we just can't get the blood sugar regulated. Stimulates epinephrine and norepinephrine. So that's like adrenaline. That is just too much pumping of that adrenaline rushing out. And then that's going to affect your cortisol levels. And so cortisol comes from your adrenals, which is the little glands on top of your kidneys. And so all of this is working together because your body thinks you're supposed to be running. It also affects all of your reproductive organs, as well as at the very bottom, you can see peripheral vasoconstriction. And to bring that into super simple terms, it's cold hands and feet. How many of you have cold hands and feet? I do right now, but I'm in North Idaho in a really cold house. So if you are typically in a situation where you have cold hands and feet, then you may be dealing with some peripheral vasoconstriction. Now, I'm not going to go through the whole side on the relaxed side. Just know that it's the opposite of everything that we just went over. Everything is calm and relaxed. Everything is working optimally. And so we have a lot of really good things that are happening effectively, and nothing is being constricted or restricted. I just saw a message that my audio cut out. So if I do start cutting out and I need to call in on the phone, somebody, Seth or somebody, please let me know to do that. So, okay. I'm going to keep going because I'm not going to stop and look at the chat. If it's something that I need to know, if somebody will just unmute and let me know that. So balance is the key when we're looking at the central nervous system. Okay, so we're looking at balancing those sympathetic and parasympathetic systems. And the sympathetic, like we just looked at, that's like the gas pedal. It's fight or flight, protection and survival, stress response. Everything is activated. Parasympathetic, that's the brake system. That's time when our body is actually in that state of rest, when our body is able to digest, when we're able to relax. That's when growth and development occurs. And so you can't be in growth and protection at the same time. So it has to be one or the other. So this is a seesaw balance that always is trying to stay balanced, and it is truly a balancing act. So up till this point, we've been able to support our stress with some essential oils. And these are some examples of ways that we've used some resources to know how to support ourselves with essential oils. doTERRA has been wonderful in providing us so many essential oil blends that allowed us to support our stress responses, as in the emotional aromatherapy line. I love those and I use them very often. I also use the Essential Emotions book and the Feelings Buried Alive Never Die and the I Am Fabulous books, and things that help me have more tools of how to use essential oils to manage stress. As a physician, I will tell you, for me, it wasn't enough. I needed more. I needed something more to provide my patients with than just essential oils. The essential oils were amazing. They made huge difference. I needed more. And so doTERRA introduced the adaptive system. This came out in September of last year. It was their mind and mood wellness, and this is their definition. It's a toolbox to help the body and the mind stay balanced during life's stressful moments. And these are the oils that are in these systems, and I'll go over those a little bit more in depth in a few moments, but just wanted to list them all here before I go into it a little bit deeper. So this was a game changer. And I was telling Seth in a couple of weeks ago on a call, I was telling you guys that this was such a big deal for all of us physicians that were sitting in that auditorium when they announced this. We had been waiting on this with bated breath, because we had been treating with a lot of these things for a long time, and we would get partial results. And so to see that they came out with something that was very complete, words do not explain the excitement that we felt. I was telling them, we were all texting each other during this, so excited that this product came out. So the oil blends, I'm going to talk about them just a little, not going into the chemistry of it. The capsules that I take every single day, they have lavender, wild orange, coriander, fennel. These all have large amounts of linalool. And we've heard our lovely Dr. Hill talk about this, so that there are studies that show it directs the activity of those calcium channels. And that's what allows that release of those adrenaline chemicals, the epinephrine and norepinephrine, to be released from the adrenal glands. And so that's what causes that imbalance in cortisol. We'll talk a little bit more about that. And the actual oil blends, so we have a roll-on bottle as well as a bottle of the oil by itself. That way you can diffuse it. Those have some amazing oils in there. Magnolia, lavender, neroli, those are all really high in that linalool and linalool acetate. Copaiba and sweet gum, beta-carotene. These, we're looking at the endocannabinoid system here. Those in there, they make a huge difference in the way that it helps the longevity of this, of the reduction of our stress responses. Spearmint, wild orange, oh, I put spearmint in there twice, so I guess it's got it double. Some limonene. All of these have those profound effects on the olfactory system. And so the olfactory system, which is the way that we smell, it really affects the cortisol levels. And you may think, well, how does something that I smell have an effect on my chemistry? How does it affect my body's physical reaction? Think about when you go to the dentist. I love this example that's used about when you go to the dentist and they need to sedate you. What do they do first? They put on the little mask on your nose and have you take in deep breaths. When you go for a major surgery, they want to sedate you first before they actually sedate you deeper. And they have you breathe in a mask and they say breathe backwards from 100 and you get to about 99, 98. And it's because as you breathe in those synthetic chemicals that are created to relax your body, the olfactory nerve receives that odor. It has a response on the brain. It tells the brain to tell the body to relax, and that's what happens. So when you're in a dentist chair and you get that laughing gas, you know, on your nose for just a few seconds, that's what happens. It tells your body to relax, and then they're able to inject the anesthesia into your oral cavity and do the work. Well, when we are breathing in oils, like I've got a diffuser going beside me as I'm talking to you, these oils that are being broken down into small particles so that my olfactory nerve receives them really well, because the olfactory nerve is sensitive to size, then it's going to tell my body to relax. And so the oils in this particular blend, they're affecting that cortisol level and helping it to normalize. And so we want that inflammatory response to be normalized. So cortisol itself, when it's elevated, it can inhibit our immunity. It can cause dysregulation in our glucose. It also helps that stress level be counteracted and helps us just maintain emotional stability. So, you know, when we're looking at things that cortisol does, we want cortisol to be at the correct level, not too high, not too low. So these oil blends are really wonderful for helping that regulation take place and to just bring a calming effect to our entire system. So when we looked at what did we need, you know, I said we needed more. So there's a lot of herbs that we used in naturopathic medicine to address stress. There's a lot of nutraceuticals that we use as well. Sclerotium, this is one of the herbs that it is not very well known, but it is very effective. And so the studies are just amazing on this. This is a plant, it's actually a succulent, as you can see, from South Africa. And it contains compounds called alkaloids. And alkaloids are very effective at promoting that sense of well-being. One thing that it does is it reduces that stress signaling within the brain. So we have different compartments in the brain and they all communicate to each other, and they're telling the brain to either cause stress reaction or stress reduction. And so it reduces that stress signaling within the brain pathways that then has the result of reduce those mood effects. So we are not going to have as exaggerated a swing in mood, so to speak. We also see a reduced response in the amygdala to stress factors. Really quickly, the amygdala is the part of the brain that when it receives smells, it has a response many times due to memory. That is where our emotional memories are held. So let's say you have an emotional memory of a family member, say a mom or a grandmother, making a specific meal that had a very specific smell to it. And so when you smell that scent now, it immediately carries you back to that moment in time, so that you may have that emotional memory pop up of grandmother's tea cakes, or my Aunt Betty's banana nut bread. You know, whatever it is, you're like, oh, that takes me back to when I was a child. That's your amygdala reacting to that olfactory nerve, and you're having a response. If it's a great memory, you're going to have a great response. If it's a negative memory, you'll have a negative response as well. We see a lot of times people are triggered by smells with PTSD and different things that have happened to them in their life that was associated with a particular smell. So this scaledium root actually helps to reduce that amygdala response to stress factors. Now, this next part is the part that had me like jumping up and down. This root, this herb blocks an enzymatic transporter. So it's 5-HT. 5-HT is what we call a precursor. So it's what the body needs to make serotonin. It also selectively inhibits some enzymes. They're called PDE4. And when it blocks these two, it allows the sustained ability of serotonin and GABA. We're going to talk about GABA. If you're not familiar with GABA, you will be by the end of this. In the pharmaceutical world, there is has been for the last few years a very promising approach of treating anxiety and depression with SSRIs and PDE4 inhibitors. So that's been a combination that's been treated in the been used in the pharmaceutical world with growing response of combining those two for that promising approach to those conditions. Is not effective for everyone, but it does, like I said, have some promising approach. The scaledium has that synergistic potential as well when it's combined with GABA and ahi flower, which we're going to talk about next. So when scaledium was introduced in this formula with that high number of alkaloids, that gave us another component in this formula that was very needed. So as I promised, ahi flower, we're going to talk about it. It's an omega-3. We know these are fatty acids. We call them PUFAs. So the ahi flower, I love this being in this formula for a lot of reasons. And one of them is because in the field that I'm in, as far as treating a lot of Epstein-Barr, I try to stay away from fish-based omegas. And so the more plant-based omegas that I can offer patients, the better. This is, of course, as you can see, a plant-based omega-3. This looks like a lot of science, I know, but I'm going to break it down. It's really simple. So there's 20%, it's called stearidonic acid, and you can just call it SDA. There's 40% alpha-linolenic acid, we can call it ALA, and then there's gamma-linolenic acid, and when that's elongated, when it has extras, it's also called DGLA. And DGLA has anti-inflammatory properties. There's a study where they compared this to flaxseed, which has 59% ALA and none of the other two. So the wonderful thing about ALA, this is the richest known non-GMO source of stearidonic acid, of this SDA. And the reason that that's important is when we have stearidonic acid and alpha-linolenic acid, so those two up on the top, the SDA and the ALA, when we have those two working together, they convert to our omegas that we hear so much about, that DHA and EPA. So there was a trial study done. It was a 28-day trial where they showed that in the blood, so in the increase of plasma, they saw in the EPA a 3-fold increase from the start to the finish. And the majority of it happened in the first 2 weeks. And this was compared to flaxseed, which had a 2-fold. So it still was doing great, but it showed that the ahi flour just outdone the flaxseed. So flaxseed's really popular. I use it a lot, have my patients using it a lot because it's a really great form of that ALA compound. It's easy to use, throw it on oatmeal, all that. So now I can double whammy. Now we can use flaxseed in our daily food plan, and we can find Adaptiv as part of our nutraceutical regimen, and we're getting both of these, so we can get both benefits. So this was just a great study that showed the benefits of the ahi flour, and it's a decent dose in here in this Adaptiv. So let's move on to what we needed more of. We had the essential oils. Now we've got the herbs. Now we got the omegas. We needed some amino acids. And you may say, what are amino acids? I hear it. It's a big word. We hear a lot about it. Well, amino acids are neurotransmitters, and they're also the building blocks for neurotransmitters. So we're going to talk about glutamate and GABA. And so these two are, they're kind of like the fighting two in the brain. When I remember when I was in medical school and I was shadowing with the doctor that I ended up working with, Dr. Satya Ambrose, she talked every day about GABA and glutamate. And I saw her draw this out over and over and over. And it made me hungry to know why she kept drawing this out. And it was because if a patient comes in and they have an excess stress response, then she knew immediately they needed more GABA. They had too much glutamate. They were too excited. Their nervous system was too excited. It's not that they were emotionally excited. They were mentally excited. Their nervous system was excited. So we needed more. We needed essential and non-essential fatty acids. So this is chemistry. Don't panic. So I just wanted to bring this in here because you see all these words sometimes and you're like, I don't even know what they mean. So let me break it down. On the left side, the essential, that means it cannot be made by our body. Essentially, we have to get it from somewhere else. We've got to get it from our diet. We've got to get it from our supplements. We have to get it from an outside source. We use this little catchphrase, Private Tim Hall, to help us remember phenylalanine, valine, threonine, tryptophan, isoleucine, methionine, histidine, arginine, elastine, leucine. Arginine, elastine, that's a whole nother class we could talk because herpes viruses are another big specialty of mine, and so they fall in that category. So let's focus on the non-essential. We can't make these. We can make these. These can be made within our body. We normally have them in our body. They also can pair together and create other compounds. And so the one we want to focus on is glutamate. And it's also called glutamic acid through a little bit of a process. And you can see at the very bottom, GABA is glutamic acid plus some vitamin B6, and it happens with the help of an enzyme called glutamic acid decarboxylase. So this is an enzyme that we have to have for GABA to be made. So what do you think happens if we're deficient on B6? We're not going to be able to make enough GABA, right? Right. So we not only are looking at, well, we've got to make sure that we're getting enough GABA in our body or glutamate. We've got to make sure that we're getting enough vitamin B6 or our body can't make the GABA that it naturally is going to make, okay? So this is a beautiful neurotransmitter. We hear a lot of talk about them. This is a beautiful nerve and nerve ending, and the little sparklies in the middle, those little fireflies, those are neurotransmitters. And this is actually what nerves look like and the nerve endings. And that communication that happens between the nerves, that's what is super important and what we're going to talk about. And I don't want you to be afraid. There's not a test at the end, but you will know more. So how do neurotransmitters work? Remember this beautiful picture, okay? Don't be afraid. Here we go. We're going to walk through this, and what I want you to do, I want you to focus on the picture while I walk you through this story. This is the end of this, okay? So we've got this nerve. This is a nerve cell. At the very end of it is what we call an axon terminal, so it's coming to the end, okay? Let's see, make sure everybody's like not freaking out on me. Okay, nobody's freaking out. Okay, good. Oops, let's go back up. All right, let me walk you through this story, and you keep your eyes on the picture, okay? So here's the beautiful nerve. This is the axon terminal, meaning it's coming to the end, okay? So what happens, we've got a nerve signal happening. And so the signal comes down the nerve cell, travels through it towards this axon terminal, towards the end of it. And so when it gets down here, it triggers the release of these little sacs that are filled with chemicals called neurotransmitters. And there's a lot of different neurotransmitters, and we'll talk about some of them. So these chemical-filled sacs then travel to the very end of this nerve cell called a neuron. So this nerve cell has these sacs that come out to the end, and they just kind of like spill it out of the outer edge here. It just spills it out into this gap. And this is a gap called a synapse. So there's a little space. You can see it on this other beautiful picture where they're floating in the space. This is what they do. These nerves are not actually touching the tissue that they're connecting with. They just get close enough that the molecules can transfer from one to the other. Okay, we'll go back to this diagram. So here you can see as it merges with the outer edge, it spills into this space. Okay, so these are different kinds of chemicals. It might be dopamine, it might be serotonin, it might be glutamate, it might be GABA. All of these things are neurotransmitters. And so they move across this gap through this space between the nerve and whatever they're going to attach to. So they might be attaching to a muscle. It might be attaching to another nerve. It might be attaching to a gland. Whatever it is that it's attaching to, on the other side are these little receptors. You see, they kind of look like teeth. Well, these are receptors, and they're very specific for the chemicals that are coming towards them. And so let's say this is a dopamine receptor, and this is not dopamine. Well, it's not going to take it. They're very specific. But if this is GABA, it's going to accept that. And so it's going to take that chemical, and it's like a lock and key. So, you know, like if you put a key in a lock, you can't put another key in there. It will only hold one. And that's like this process. It's a lock and key. And when that chemical attaches to its receptor, it locks it in. And once it does, it changes the shape of that whole system. So that receptor changes so it can't accept another one. And when that change happens, it stimulates an action in the cell for whatever that neurotransmitter is telling it to do. So you remember, back up here at the top, transmitters are chemical messenger cells that tell the cells what to do. So whatever this is telling it to do, it is going to change the cell into that action. So remember I said we're going to talk about GABA and glutamate, and it's important because of what we're looking at. Glutamate is going to tell the cell to be excited. It's going to tell it to be active. it's going to tell it to ramp up. So here's an example. If I have someone that has too much glutamate, they are overstimulated a lot. They may have sensory issues. They may have ADD, ADHD. They may have some heart conditions. They may have a lot of things. And I'm like, they have a lot of glutamate going on here because their nervous system is super excited. If this signal coming across is GABA, it's going to tell things to calm down. I love this picture, this little sloth just saying, just slow down, slow down. It's kind of like what's been happening with the stay-at-home orders. We've all had to kind of slow down. We've had a big infusion of GABA across the planet of like, slow down, stay home with your kids, work in your garden. That's kind of GABA. He's a little sloth. He's going, just slow down. We're going to calm things down. And that's exactly what GABA does. GABA calms things down. We need neurotransmitters for every function we can imagine. Without them, we're not going to make it long, because the neurotransmitters is what tells our body everything it needs to control these organ functions. That's what controls your heart rate, your breathing, your digestion, even your muscle activities. That's what happens, controls your sleep cycle, your concentration, your mood, your appetite, everything. So GABA and glutamate, it's a balancing act. We don't have to get into every bit of this, but glutamate is needed for learning, memory, development, all of that. But we can get too much of it. It's big in processed foods. We know it in MSG, that monosodium glutamate. If there's too much of it, and we found this in the autopsies of autistic persons, that they had an increased number of glutamate and their receptors were super sensitive. So they grabbed all of it. And so we know that things that affect that are diet. So I had a really great picture of junk food, because glutamate is big in junk food. Heavy metal toxicity, chronic inflammation. If your detox pathway, so if you've ever been told you got like fatty liver disease, or your liver enzymes are high or anything like that, you may have some dysfunction in your detox pathway, which happens in your liver. And so you may be feeling, like a little bit more of this glutamate increase. ADD, ADHD, autism, all of those things we have seen in studies that they may have too much glutamate. GABA is also required. We need it for processing, because if you go to sleep and you're in that excited state, your brain functions that you had during the day, they're not going to go through that processing system that they do in the night, where everything's filed away, and your sleep is not going to be great. You're not going to be calm, and your sensory integration is not going to be optimal. So that's the balancing act between GABA and glutamate. And the role of GABA, like we just said, it's really counteracting that glutamate, uses to balance it and to help when we have the anxiety fix, because it's called an anxiolytic agent. And so there's a lot of medications that act on those GABA receptor sites. So you may see in this, there's a list of medications that is their role, that is their purpose, is to bind to those receptor sites as GABA. And there's 40%, remember those synapses, remember that space in between those nerves, that gap, remember those are synapses. So there's 40% in our brain, 40% of the synapses in our brain have GABA receptors. So that is super important to know, that we need this molecule going into our brain. We got 40% of our receptors have GABA receptors. And in our brain, it's super protected. We've got this blood-brain barrier. This is a beautiful picture, and I brought this in here because in essential oil training, we talk a lot about the blood-brain barrier, because there's only a few oils that can really cross that. And so you look at a regular capillary size, look how thin that is. It's one cell thick. It's just one red blood cell thick. Capillaries, big thick capillary protection in the brain to make sure that there's tight junctions, there's nothing getting through there. It has to be very specific for what gets through there, so that's important. So GABA, really quickly, this is super important because as we look at how to take the Adaptiv supplement, you may have it and you're like, well, I've got this, but I don't know how to take it. Well, know this, you've got to know your body a little bit. It's going to help with your sleep. It's going to help with your body temperature. It's going to help with mental and physical stress. And GABA plays a role in regulating muscle tone. And I will tell you that we have seen a difference in people that are taking GABA on a regular basis, that they've seen a change in muscle tone. So at the bottom, this is some pharmacy information, but it helps you know how to utilize what you have, your GABA, the onset, which means when it kicks in, it's about a half an hour to an hour before you actually should feel it kick in. Its max concentration is going to occur around an hour to an hour and a half, excuse me. And then the half-life, which means that's the time that half of it has already depleted, is about 5 hours. So that's what helps us as physicians know when to prescribe redosing something. So the dosing suggestion for GABA in general is about 100 to 200 milligrams a day with side effects found at like 6 grams. That's a lot. You know, in my practice, it would be nothing to see. For me, treating someone with a physical condition that and emotional condition that I knew that they needed a lot of supplemental GABA, I would increase that dosing, but I'm watching it closely. So these dosings are as directed, from doTERRA with our product we have. So I want to keep that so that you're not going above something that's safe for you. If you're low in GABA, if anybody you know is low in GABA, this is what you may see. And so you look at this, anxiety, chronic stress. There was a study that showed that someone that was given 100 milligram, which is actually what's in our Adaptiv, is 100 milligram per capsule, it slowed the brain waves down after a stressful task, which is very important to us because we need those brain waves to be slowed down. It could cause depression. If you're low in GABA, you could have difficulty concentrating and have memory problems. They did another, in that same study, they showed that given the GABA helped them perform a difficult math problem with much more ease and less stress about it. Low GABA could also have muscle pains and headaches. You could have a lot of sleep problems. In people with sleep problems, there's 30% that have less GABA. So that's insomnia is a big problem in today's world. It's also associated with a lot of substance abuse disorders. And we saw this in our practice where that if someone had a substance abuse problem, if we could get their GABA levels back up to normal, we could help them in a lot easier fashion of recovery. So when to consult your doctor? Always. If you're looking at, I've got a new nutraceutical, which is what we love to call these, that are nutritional supplements. And I'm also on medication for high blood pressure, or I'm on a medication for depression, or I'm on a medication that is a neuroactive medication. So we're talking here about something like, if you're a big time energy drinker, or you drink a lot of caffeine in a day, or you, anything that's going to be that super stimulating to your nervous system, you want to consult your doctor before you start taking something that has something like GABA in it. Just to be safe, you want to make sure that you are careful. And so I love when people would bring in their supplements and they'd say, what do you know about this? And I'd say, I don't know, let's look it up. And I would look up the ingredients and I would be able to help them know if it was safe with what's going on with them and their current medication. So take it into your doctor, get your naturopath to take a good look at it. Here's a big added bonus. This is so amazing. And this is something I'm going to tell you guys. For those of you that saw Dr. Hill's presentation a couple weeks ago when they rolled out the Adaptiv app, I had written this whole presentation before I got to look at that. And I sat down and looked at it, and I was like in tears. I was like, God was working with me, bringing this presentation together, because it was pretty much exactly what he was saying, and I didn't even realize it. It's just because the information is that amazing. Theanine alters glutamate transport. So remember, when we look back at that science screen of the neurotransmitters and how it came down that path and crossed that membrane, crossed that synapse and through the membrane, and we saw that glutamate transporting, the neurotransmitters coming across and attaching to there. Well, so theanine is an amino acid that helps that glutamate be transported, because we need glutamate to make the GABA. So if we have theanine, we're going to have plenty of the glutamate being transported where it needs to be converted into GABA, and we get theanine in the Serenity Complex. This is an amazing complex that helps us, with restfulness at night. I've even used this for patients before they came out with Adaptiv. I was dosing the Serenity during the day for patients with the needs that Adaptiv is now taking care of. So that's a super added bonus that I'm excited about. So this looks confusing, but it's not. It's going to pull everything together for you guys. So I want you to think of this set of balloons up here in the right-hand corner where you see alpha, beta, gamma, alpha, beta, gamma. This is your GABA receptor. Remember, we looked at those they look like teeth, remember? There it is again. Here's glutamate, comes into our body glutamine, and then it goes through a process to change to glutamate. So we brought it in through diet, and inflammation is going to, and you can see down here at the key, it's going to disrupt things, and red's going to inhibit, and the green's going to promote it. So when we're looking at, we need glutamate to become GABA, and then to be accepted by this receptor, here's all the things that are going to interfere or promote or just totally disrupt it. So when we're looking at our nutritional status, if we've got a B6 deficiency, it's going to have a harder time converting glutamate to GABA, which is what we want. Remember, we want both. We want the balance. We have magnesium deficiency. We need it to convert it. If we have chronic stress or glucocorticoid elevation, it is also going to inhibit GABA. If we're providing a supplement like we are, it's going to promote GABA. If we're taking probiotics, which is very important because of the receptors that are in the gut, we've got receptors all throughout, and especially in the gut. And so we need to be providing our body with the right probiotics that helps the enzymes be effective. So this is glutamate decarboxylase. This means it's going to help glutamate turn into GABA. If we have infections, and remember, I'm a chronic infection doctor, and so I wanted to help people reduce their infectious rate so that we can get them into this state where things are attaching more effectively, okay? Also, if we've got high copper and low zinc, and I'm going to show you in just a moment how we can address that. So this looks very confusing, but it's not. It's the ways that this GABA, the glutamate that we eat, and then we have B6 and magnesium that helps it, the amount that needs to turn into GABA turns into GABA, and then the receptor is able to accept it. So these are the things that are going to help it do that, or they're going to interfere. So this helps you look at your personal health and be like, okay, my doctor told me I'm really low in magnesium. Well, that may explain some things now that I'm seeing that I'm not being able to make enough GABA, so I might be glutamate excess. So it kind of helps you look at your own health and say, how can I help myself in this situation? So let me show you what I say. We've got some amazing products. We love our Lifelong Vitality, which is this section right here. We've got this Microplex VMZ, and I'm telling you guys, I have searched and searched for a better vitamin mineral supplement than this, and I can't find it. And it's because I just wanted to see if there was anything better than what doTERRA had formulated. Their scientists are geniuses because they know exactly what the body needs, to work functionally optimal. And so the Microplex VMZ is the vitamin mineral supplement. So it's going to give you your B6, it's going to give you your magnesium, it's going to give you the right ratio of copper and zinc, and that's very important because if you just like load up on one without the other, they counteract each other. When copper goes high, zinc goes low, or vice versa. So you need the right ratio of this. You also need alpha CRES, which is very powerful herbal formula of antioxidants, and that's going to help with this system, which is your inflammation. Because what does inflammation do to this whole process? It disrupts it. It disrupts both of these enzymes, which is helping your food turn into your stress reliever. Then we've got omegas. Again, that goes back to inflammation. Gut health at the very bottom where you've got your TerraZyme, that's your digestive enzymes, because that is going to help this enzyme. It's going to help it do, this is one of your metabolic enzymes that we talk about a lot. We've got digestive enzymes and metabolic enzymes. This is one of our metabolic enzymes that the digestive enzymes allows the food to be utilized and dispersed through the body so that our body can make the metabolic enzymes that it needs. So that's really important that we have digestive enzymes in our system along with our PB Assist, our probiotics. Here's our Serenity. This has got that theanine in it. It's an amazing restful complex to help with your sleep habits. Here's your Adaptiv, and then Copaiba. This is a beautiful Brazilian oil. This is amazing for any kind of muscle and joint discomfort, but here's what I will tell you. I'm a licensed physician in the state of Oregon, and for those of you that know, Oregon is a medical marijuana state, and it's also a recreational marijuana state. So I have had a lot of patients over the years that wanted advice on using medical marijuana and recreational marijuana for their sleep issues or for their anxiety. Here's what we saw over and over again, and the studies have proved it, that consistent use caused an increase in anxiety. What we have seen in our personal clinical just observation of using Copaiba for those same issues, we actually over the longer term saw those anxiety feelings and those excess stress responses, we actually saw them go down. And so this has been like huge for me when I'm trying to help patients that are in any situation where medical marijuana is, or recreational marijuana is not an option. And so that would be like if they're in recovery, if they're a fear of being tested, if it's a personal belief, whatever it is that keeps that from being an option for you, this has been an amazing option, I will tell you. And all of us physicians that are using doTERRA products, we have really been able to see great effects by using the Copaiba or Copaiba. It comes in an oil, and I love this one because whoever took this picture, they used a dropper bottle on the Copaiba bottle, because I am not good at judging 2 drops under my tongue. I think I usually probably get about 4 or 6 in every day. And then it also comes in a soft gel, so that's a great way to just have it in your bag and take it with you on the run. So, okay, so this is the new adaptive system that doTERRA just released in the last couple of weeks. So not only have we really been enjoying the power of these essential oils and the herbs and the omegas and the amino acids, they've also now partnered with a company that is helping to bring in those daily habits and help you measure that and help you see. And for me, what this really did, this was like another way for us to empower people, empower ourselves. So for me to be able to take my own health into my own hand and on my smartphone, and I can use the app and I can use the daily practices, because I was already using other apps. I was using, we've used Headspace, we've used Calm, and then we've been using Insight Timer, just a way to like have a daily meditation way of just of calming ourselves, you know. So this is a great way. I downloaded it immediately. And so I love that it's able to like take your voice, and because our voice really portrays our stress levels. And so it allows us to like measure our improvement over time. And so for all of us doctors that have used biofeedback for many years to help patients see their progression, this is just another added bonus. So we're super excited about the addition of the app. And so the great thing that right now with all this going on with the global health crisis, it's a great time to get in and try it, because they're really offering, you know, us some great deals on getting this, I'm going to say for free or a really reduced price during this time. So really want to encourage this. So this is the system, and this is during normal times. When we're looking at this, so this is the adaptive system. We're looking at the capsules, and you get that 1 month subscription of the app, or you could just outright get the app itself if you've already got the products already. If you are new and you do not have your own doTERRA account, I want you to get with a person that invited you here tonight, because this is something you and your family do not want to be without. We love to have adaptive diffusing in our house. It even helps our dogs. It helps in so many ways just to really shift that stress response. I love the roll-on because I can just take it with me, and if I start to feel my stress response shifting in an upward motion, I can apply it again. And this adaptive system has been a life changer for me. And okay, I'll try not to get emotional. One way that I promoted this is I have had a heart condition called atrial fibrillation, and we just shorten it, call it AFib, for many years. And it started, I think, in my second year of medical school, and we've tried for many, many years to get this under control, and nothing has ever worked. And we knew that after all the testing that it was a stress response. So I had tried everything. I tried every oil. I had tried every supplement. I had tried every practice. I'd done everything that I could. It was nothing for me to go into AFib every few days. You know, sometimes it would be every other day. Sometimes it would be every 3 days. And I will tell you that now is the first time that I can say in many years that I now can go more than a month without my body having that stress response. And that is a huge testimony for me. For those of you that know me, know what this heart condition has done to me. But I know the thing that I have stayed consistent with is my adaptive and the meditation, and allowing my body the time to heal, getting the right nutrition in me, taking my LLV, making sure I have plenty of magnesium in my system. All these things that we just talked about that your body needs to function optimally. This is the greatest time in our life that we are empowered to take our health in our own hands. So I want to ask you, are you ready to experience the power of this adaptive system? I hope you are, because you will not regret it. So I am really excited that all of you are here joining me. I hope I've answered all of your questions that you've had. I've not looked at the chat, but it has been my honor and my privilege to share this information with you. For those of you that know me, you know I went to medical school to serve the most people, and to be able to bring the information that I have to everyone. We all know doctors that feel like the information they have is their little secret. I don't have any secrets. If I know something and you want to know it, I'm going to spill it on you, because I know that my job as a physician is to be a teacher, and I'm going to share all the information that I have that may help you so that you are more empowered to take your health into your own hands. Thank you all so very much. I am blessed and honored to be here.
Hey, Dr. Dolores.
Yeah.
All right. I have, before you end, I have a quick question, because I want to make sure I understand how to do this. If you could go back on your slides, I think you just ended your slide, but there was a slide that had the picture of the Lifelong Vitality, the TerraZyme products, the
Yeah.
Serenity, Adaptiv, and so forth. What I want to know is, so what is the protocol you're suggesting?
Okay.
Like, so how often do you take Serenity versus Copaiba versus Adaptiv?
Yeah.
You know,
So I will say that, great question. Thank you, Seth, for that. So, of course, the Lifelong Vitality is, I love to take and recommend a full dose every day. I know that there's a lot of people just, that might recommend altering that dose, and that is totally a personal finding. But I have found for optimal nutritional value that taking a full dose of your Lifelong Vitality daily, you can take it in divided doses. You can separate it into 2 or 3 different times, whatever works for you. TerraZyme, I love it with every single meal. I love to have patients take at least, yeah.
go ahead. Sorry.
Okay.
Keep going.
At least 1 capsule with every meal, just because it's allowing you to have that digestive enzyme support, as well as the PB Assist. PB Assist, you want to take it away from food so that it has time to travel through the digestive tract, because if you've ever looked at the probiotic that we have, it is a triple encased so that it has, because it also has a prebiotic in there, which doesn't need to be released until the small intestine. And so you want to take it away from food so that it has time to travel through your system before it's broken loose.
How many capsules do you recommend with PB Assist a day for, if you're like, I know that after I do a GX cleanse with a GX Assist, I'll take 3 of those a day, but generally what would you recommend for that?
And some of that depends on the gut health of the person. If you've got a really good gut health, which means you're eliminating regularly and you are not having any symptoms, throughout the day, probably 2 would be a good maintaining dose. You may be able to work with your healthcare provider and let them look at the dosing and see if 1 would be more effective for you, or 1 to 3, whatever. It is still a low dose probiotic. I think it's only 50 billion CFU, so or 5 billion, I can't remember, because we dose in a lot of different ways. So it is a lower dose, and so it is something that you could take 2 of every day and feel the benefits of that.
Okay, so 2, so full dose of Lifelong Vitality, TerraZyme with each meal, PB Assist between meals, maybe 2 of those,
Right.
and then keep going.
And let me tell you a little something about the TerraZyme that we loved in Portland. We played with the TerraZyme a few different ways, me and some of the doctors. So if someone had an autoimmune disease, we had them take the TerraZyme with a meal and then between a meal. Because with a meal, it's going to act as a digestive enzyme with the food that you're putting in. And then we would have them take another one, like just 1, in between the meal to help eliminate any food that was like left over. Because what we found in a lot of people with autoimmune disease is that their digestive system was not working optimally, so which meant there was some residual material left in the stomach, and that was creating toxins being released in the body. So if we could get the enzymes in there to help the body eliminate the rest of the material that was in the gut in between the meals, because if you have that, and your stomach is emptying not optimally, then you've got material just sitting in your stomach, and it's decaying in your stomach, and it's putting off gases. And so we played with taking it with meals and between meals. And so we started saying, if you're using it for autoimmune, take it between meals. If you're taking it for gut health, take it with meals. So we just did both. And we had great results. So that kind of helps like if you're in that situation where you're looking at autoimmune, you might want to, look at investing on doing a hefty dose of TerraZyme and work with the person that brought you here so that they can coach you through it. But really hitting that TerraZyme heavy, we've seen some really good results with like chronic pain reduction, autoimmune reduction, just a lot of good things. So, and then the Copaiba, I like to start the morning off with that too. And then I have seen some situations where people had sleep disruption. It was taken after 6 o'clock, but it resolved over time. And so I kind of work with the person individually as far as like what their sleep quality is like already. If they're prone to having nightmares or bad dreams or disrupted sleep, I don't want them taking it after 6 o'clock in the evening. Or actually I've said, just try it once and see what it does. If it doesn't affect your sleep, you can take it morning and night because of the long-term effect
Is
of
it one capsule in the morning, one at night?
I do the drops. So one capsule morning and then one capsule at night could definitely be sufficient. And then I would do like 2 drops in the morning, 2 drops at night I just take it from the bottle.
Okay. And then the Adaptiv and Serenity, where do those fit in?
Okay. So the Adaptiv, I take it morning and then again in the evening. So I heavy dose because I know from my personal health, I am very low on GABA because I have a heart condition. I have ADD. I have a lot of sensory issues. So I know I'm just prone to low GABA. So I take 2 capsules in the morning and 2 in the afternoon. So I like to really heavy dose on this, but average person, like my daughter texted me the other day and she was like, okay, what I do for, she was asking about my grandson who has a sensory issue. And so I don't mind heavy dosing him. I will say that for me, a max dose on the Adaptiv capsules would be 6 a day. And that's because that's a 600 milligram, because there's 100 milligrams per capsule. And that's about the top of my dosing in my practice would be around 600 milligrams a day. So depending on your body habitus, I'm a larger person, so I can handle 400 milligrams a day with no problem. Somebody smaller or a younger person may need less. So I would go, at least 1 capsule a day and then play with it and see, you can work your way up to 2 a day, work your way up to 3 a day and see where your optimal dose is at. I would not go over 6.
Okay.
And then the itself, we diffuse the Adaptiv just periodically and sometimes every day, just depending on the mood in the environment. And then the roll-on, I love to put it on in the morning starting out my day. And then anytime that I feel that stress response elevating, I love to hit it again. And so those are there. I have multiple bottles of those everywhere. So I love to have access to them, wherever I need them. And then the Serenity. So people that have low GABA, majority, and we saw that 30% showed to have fewer GABA receptors, but I would say that number is a lot higher in clinical setting. Probably 90% of my patients that have issues such as anxiety or depression, they also have sleep issues. And so the Serenity at night, I'd love to diffuse it as well as take the capsules so that I'm getting that double benefit. Like I said, before Adaptiv came out, I used to prescribe it to be taken in the daytime as well to help with that elevated anxiety issue. But now I use the Adaptiv during the day and the Serenity at bedtime. So I usually, that second dose of Adaptiv is usually in the evening time. And sometimes it may be as early as 3 o'clock, if that's needed. And then the Serenity about an hour before bed.
Great. By the way, there's a lot of people who are praising your name in the chat. Are the capsules safe for kids?
Yes, they are.
Okay.
So my grandson is 11 and he's probably about 100-pound kid. And we've got him currently on 400 milligrams a day. But like I said, he is sensory. He's got some autistic tendencies. And so we dose him a little higher. If I have a kid that has very mild symptoms, I'd start him out with 1 capsule a day, because kids are, when we look at like what causes glutamate to be so high, a lot of times it is our daily food plan. So it's our dietary intake, and the more junk food, the more glutamate. And so then we're looking at, because we've never seen so many kids with ADD and ADHD and spectrum kids as we see now, and sensory kids. It's mind-blowing of how many kids are having these issues. Well, a lot of it is our food choices, and then screen time, all these things that are causing these excitatory neurons to be firing. And so I love Adaptiv for kids. I mean, I knew right away, like, I bought my grandkids these systems because I was like, I want my grandkids on this GABA right now and using the oils. So it's a great, it's very safe for kids, in my opinion.
Thank you. All right. Well, thank you, Dr. Dolores Stevens, for your awesome presentation. Thank you to everybody who came to this event. And we'll get the recording posted shortly. Thanks, everyone.